Okay, you guys, so we have a lumbar spine skeleton and the sacrum. These are called transverse processes, L1, L2, L3, L4, L5, L6 transverse processes. Here are the intertransverse joints of a horse that move for when a horse canters. These joints actually move together for a horse to sit. The sacroiliac joint is here, where the ilium attaches onto the sacrum. And as I said before, if there's movement here, we are in big trouble and the horse is very crippled. So on this horse, I presented it out in Oregon at a rehabilitation symposium in 2012 or 2013 on transverse process injuries in sport horses. And I was noticing that these changes were happening in horses. This is not normal. There should be spacing in between all these transverse processes. But as you can see, this transverse process is actually kissing, right? Kissing this transverse process of L5, L4. On ultrasound, I see these changes. And these, if a horse is cantering, say for example, a horse is cantering here, and these joints have to move. That is, if you look at it from upside down, that is bone on both sides. And if I take that away, see the damage and the pain that has to be causing the horse. As this is trying to move, it's simply bone on bone, which is very, very painful. It means that this facet can't move. None of this can move. It is actually immobilized and locked. If this was a dorsal spinous process like this, if it was standing up like this, we would call that a dorsal spinous process of the thoracic spine, and we would consider this, quote, kissing spine. Well, it is actually overriding transverse processes of the lumbar spine versus overriding dorsal spinous process of the thoracic spine or the lumbar spine. If you have a horse, this horse had kissing spine, more than likely you also have, because the musculature down here is being pulled together to pull these dorsal spinous processes together. As you can see, this was kissing spine. As you can see, the kissing spine that was present here causes damage deeper. We are treating a symptom up here, except if there is a genetic component to the kissing spine. If we have kissing spine here, we are going to have problems here. The veterinary profession has not examined this, but as you can see, this is very, very common on many skeletons after we do necropsy and clean their bones. That is present in the majority of horses. What is causing this? What is causing this is the fact that these muscles, the longissimus and all the epaxial muscles, which means the muscles on top of the spine, are contracted and pulling these transverse processes, but also the dorsal spinous processes, whether it's in the thoracic spine or in the lumbar spine. The other main component of this is you have to understand that underneath here, literally all underneath here, and you can see how these are all lipped up and see how thin this is. This is from these transverse processes rubbing against each other and eroding away the bone here. This is a hollow spot. And I'll take this one off. See, you can see how that locks in. It was extremely painful for this horse. And that's when I hold this like this together, this is how the transverse processes want to look and lay. What muscle is under here is the psoas minor, and over this entire region is the psoas major. The psoas minor does not move. It is a proprioception muscle, and the nerves off the spine come off here. and they run in between the psoas minor and psoas major muscle. The iliacus is here, underneath here, and it joins the psoas major that starts all the way up at T15. T15, transverse processes, covers by the psoas major. It joins the iliacus, and that thick iliac fascia that covers the psoas major and iliacus, when there's an injury to the psoas muscle, whether it's the iliacus or the psoas major, it prevents the ability of the muscle to expand, which creates a compartment syndrome, which also compresses on the ventral nerve roots. But here, these from L2, L3, ventral, or sorry, not ventral, but caudal, is called the plexus. And this plexus means that all these nerves come and they join each other. They're linked together. And because the psoas minor and psoas major cover it, those nerves are getting compressed, especially the femoral nerve, which is a big nerve that runs in between the psoas minor and psoas major, about right here. And so what people are not realizing, and we're not even considering, is the damage that's happening here to create many, many problems in sport horses that unfortunately there's been no explanation for. Now see, if I hold this like this, you can see the lipping and the damage that is present. And also the damage to the inner transverse joints here, because they move. They move. Let me attach the sacrum to this. And you can see how much damage is there. And you can also see the damage that's present to the lumbosacral joint here on this horse, which was actually also a Shivers horse.